Hello, my name is Dr. Dewan S. Raja. Today I will discuss about multiple choice questions on Hematology and Oncology 1. Let's start. Question number 1. A 5-year-old child presents with fatigue, pallor and jaundice. Blood tests reveal a decreased mean corpuscular volume (MCV) and an elevated reticulocyte count. Peripheral blood smear shows numerous spherocytes. Which genetic defect is most likely responsible for this hemolytic anemia? Choices are A. Beta thalassemia, B. Sickle cell anemia, C. Hereditary spherocytosis, D. Glucose 6-phosphate dehydrogenase deficiency, E. Autoimmune hemolytic anemia. What is the right choice? Mean corpuscular volume (MCV) is low, elevated reticulocyte count, peripheral blood smear shows numerous spherocytes. So answer should be C. Hereditary spherocytosis. Question number 2. A 7-year-old male presents with a history of recurrent infections, easy bruising, and mucosal bleeding. Laboratory investigations reveal a prolonged bleeding time, decreased platelet count, and pancytopenia. The bone marrow biopsy shows decreased megakaryocytes. Which genetic defect is most likely responsible for this patient's condition? A. Hemophilia A, B. Von Willebrand disease, C. Iron deficiency anemia, D. Bernard-Schaulier syndrome, E. Fanconi anemia. So, prolonged bleeding time, decreased platelet count, and pancytopenia all formed element of the blood. RBC, WBC platelets are less. Bone marrow biopsy shows decreased megakaryocyte. Which genetic defect is most likely responsible for this patient's condition? Our answer should be Fanconi anemia. Fanconi anemia. This is the right choice. Fanconi anemia. Question number 3. A 60-year-old man with a history of chronic kidney disease and hypertension complains of persistent tiredness. His recent blood work indicates a normocytic anemia with low reticulocyte count. What is the most likely type of anemia he is experiencing? A. Iron deficiency anemia, B. Anemia of chronic disease, C. Sickle cell anemia, D. Aplastic anemia, E. Megaloblastic anemia. So there is a chronic disease here, okay, and we have patient has hypertension, persistent tiredness, normocytic anemia, low reticulocyte count. Most likely type of anemia he is experiencing is anemia of chronic disease. B is the answer. Anemia of chronic disease. Question number 4. A 40-year-old male presents with joint pain, bronze skin, discoloration, hepatomegaly, erectile dysfunction, and pain in the abdomen. Laboratory results reveal high transferrin saturation and low total iron binding capacity and elevated transferrin saturation. Which is the most likely diagnosis? A. Iron deficiency anemia, B. Sideroblastic anemia, C. Anemia of chronic disease, D. Hemochromatosis, primary biliary cholangitis. E. So what is the correct answer? Joint pain, bronze skin discoloration, hepatomegaly, erectile dysfunction, pain in the abdomen, and low total iron binding capacity, high transferrin saturation, elevated transferrin reveal high transferrin saturation, elevated transferrin saturation. Okay, so what is the diagnosis? Diagnosis should be D. Hemochromatosis. Hemochromatosis. Okay, so we got the diagnosis D. Hemochromatosis. Okay, we got that. Now go to the next question. Question number 5. A 70-year-old male with a history of autoimmune disorders is diagnosed with a macrocytic anemia. Bone marrow aspirate reveals large, bizarre-shaped red blood cells. Nucleated red cell progenitors with multi-lobate or multiple nuclei, abnormal leukocyte and megakaryocyte. What is the most likely cause of the cellular finding? Like this. Okay. A. Myelodysplastic syndrome, B. folate deficiency, C. hemolytic anemia, D. vitamin B12 deficiency, E. iron deficiency. So in the bone marrow aspirate, we are getting nucleated red cell progenitors, multi-lobate, multiple nuclei, those progenitor has, abnormal leukocyte and megakaryocyte. Our diagnosis should be A. Myelodysplastic syndrome. Myelodysplastic syndrome. Okay, A is the answer. Question number 6. A 45-year-old male with a history of alcohol abuse is found to have macrocytic anemia. Peripheral blood smear reveals oval macrocytes and hypersegmented neutrophils. What is the most likely etiology? Okay. If we get macrocytic condition with hypersegmented neutrophil, most likely diagnosis should be folate deficiency and patient has history of alcohol abuse. So answer should be B, the folate deficiency. And these are the answers. So please share the information with your friends. If you have any question, please feel free to ask me. Please share the information with your friends again. And please support my channel. Please subscribe me. Have a nice, wonderful and blessed day. Bye now.